everybody. My name is Ramon Rodriguez. I'm a pulmonologist in private practice for about 28 years in McAllen, Texas. Be in the ICUs and hospital-based practice for about 25 years before I dedicated only to office work.
So you've seen it all. You've seen ICU, ER. You've been the chief of medicine. Um, just experience all around, right?
That's
All right.
correct. We can say that.
Yeah. So, you like how often do you see patients admitted into the emergency room, ICU, or even the trauma bay with symptoms or illnesses that could have been easily treatable if they consulted a physician earlier?
Yeah, it's a very common to see that many patients that end up in the emergency room sometimes is a result of something that has been presenting symptoms probably several days before that happened. And sometimes they do not have a family doctor, or they just do not have access, or they just ignore the symptoms because they feel like they're busy. They may not give the importance that they should.
Mhm.
And when they cannot hold it anymore, then they go to the emergency room. That's why you see like emergency room visits. Sometimes very sick patients, they end up Friday afternoon at the emergency room and late night presentations, stuff like that.
Have you been keeping up with the recent developments in artificial intelligence, particularly in the healthcare field?
A little bit. I actually tried to take a course in AI application in healthcare,
Hmm.
which is going to change a lot. Now, for example, like right now, I see very sick patients. So, I mean, when I say sick patients, I mean I see patients with 10, 15 diagnoses. I can't write all of them. It takes forever. 20 medications sometimes. So those patients, by the time I see them, they already have either sometimes a cardiologist, sometimes they already have like four or five more other doctors because by natural instinct, the primary doctors have a tendency to, when the patient have any pain or any shortness of breath, they worry more about the heart. They're more scared of the heart than the lung. So they send the patient to the cardiologist. By the time I get them, they have gone through several doctors.
Yeah.
And then when I get them, patient doesn't know everything they did.
Mhm.
So if the patient was had a story in one hospital and is seen by a doctor in another hospital, I have to log in both places to be able to access information if I need to. Um, and at the same time, I will have to get a copy of my note, which that's what I do, give it to the patient. So when they go and see another doctor, because doctor's information is not connected.
Mhm.
So AI, the ideal situation would be like, by the time I get there in the patient, it's like the AI is actually like me having the cardiologist, the internist, the dermatologist, and the any other doctor that have seen it. Like I have them in my face. It will be like an interaction, like a conference.
All right. Thank you, Dr. Rodriguez, for your time and for answering my questions. They've been very insightful. Do you have any last words or um, any last comments that you'd like to say? Of
Well, thank you. I have to appreciate Brandon for you letting me give me the chance to talk about something that
course.
not everybody seems to pay much attention these days, either because ignoring or they may not know much about the subject, especially my colleagues from my side, because I have talked to some of my friends I bring up because I went to I was taking this course and they these many I mean surprisingly many guys they have no clue what's I think what's coming to
Yeah.
them, to me
Yeah.
also and to everybody else. I think it's a positive, and I think it's going to be faster than what many people expect. And we just have to start
Wait.
getting
Yeah.
ready and
Yeah.
just getting updated because. We have to.
Yeah. All
Okay.
right. Well, thank you so much for your time. And
My pleasure. Anytime, just let me know. All right.